Hi, I'm Dr. David Maloney from the Fred Hutchinson Cancer Research Center, and I'm sitting here in the Bezos Family Immunotherapy Clinic at the Seattle Cancer Care Alliance, and I'm pleased to be joined by my colleague, Dr. Cameron Turtle. Cameron, you want to introduce yourself?
I'm Cameron Turtle, as Dr. Maloney said, one of the transplant physicians at SCCA. I have a research interest in CAR T-cell immunotherapy.
Yeah, so we're broadcasting live from the Bezos Family Immunotherapy Clinic about kind of ongoing news in the field of immunotherapy. And Cameron, I mean, the really big news is obviously the FDA approval of the very first CAR T-cell product, which has got this great name of tisagen like Lucil, which is going to be known as, I think, Kymra is the actual name. But this is the very first time the FDA has approved the gene therapy in CAR T-cells. What do you think this means for our patients?
I think it's fantastic news. I mean, it shows that there's obviously a lot of commercial support and support from the FDA behind the idea of immunotherapy. I think it tells us that the FDA is impressed with the data, the results are exciting, and that it's a good way forward to give patients with refractory leukemia a treatment option. I think one of the really exciting things about it is that this is the first approval, as you said, likely to be many more to follow.
So this is a really limited approval. The FDA approved this for pediatric and young adult relapse refractory ALL, which I think up to age 25 or so. So this is relatively limited population, but obviously it's exciting for those patients. But we really need to be able to extend that into, I think, other cancers and to the adult arena and to the lymphomas. What do you see on the horizon, for example, in lymphoma?
Well, I think there's another CAR T-cell product for patients with non-Hodgkin's lymphoma that is likely to be approved very shortly from Kite Pharma, now Gilead. So I think that's kind of the next imminent thing on the horizon. I think there will be other products that are approved. There are other companies. Immunotherapeutics is working on research. There are a number of other companies that are obviously in this space. I think that adult ALL, as you mentioned, the current approval is a limited age range. So I think expansion of that approval to older patients will also be coming down the pike. There are also other B-cell malignancies, such as chronic lymphocytic leukemia, a little further off. We have exciting data. Other groups also have exciting data in CLL, and I think there are definitely companies working towards getting a product out for chronic lymphocytic leukemia. So I think the future for CAR T-cell therapy for patients with B-cell malignancies is very bright, and I think the landscape of treatment of those patients is going to change over the next 5 years, particularly in relation to these approvals.
Yeah, I think it's been tremendously exciting. I mean, the last 3 major hematologic meetings have been loaded with reports from the Kite trials, Novartis trial, and the Juno trials, and diffuse large B-cell lymphoma, and they all look quite good, and they're very much on par with what we're getting here with our own homegrown CAR T-cell program here at the Hutch and the SCCA. I mean, it's not as good as ALL though. I mean, we're not getting, ALL, the response rates are 90+% of people going into complete remission, and we're not quite that good in lymphoma yet. And what are some of the areas you think that we can still improve that?
Yeah, I think in general the CAR T-cell field hasn't got a perfect product yet. So working out how to actually make the best cells to try and improve these response rates in diseases like diffuse large B-cell lymphoma, where there's an actual sort of mass rather than a liquid tumour, as you often have in acute leukemia, will be really important. I think critically we need to do a lot more research looking at the tumour microenvironment, so what actually is going on inside those lumps that might be affecting how the CAR T-cells work. So I think that additional research is very important to try and work out what is regulating CAR T-cell function. There are other clinical trials that we have at the moment looking at combination therapies to try and improve the response rates that we're seeing. I think many of the studies at the moment have a complete remission rate in diffuse large B-cell lymphoma of around 40 to 50%. Obviously, there's a long way to go, but adding drugs like checkpoint blockade or other combination therapies may be able to improve those response rates over the long run.
Yeah, I think those are really good points. I think it's also important for everybody to remember that just using the word CAR T cell, they're not all the same. So each of these approaches are different constructs. Each of the companies involved have slightly different CAR T cells. We're big fans here in our system of putting it into defined CD4 and CD8 types of T cells, because we think that gives us a better estimation of response and dose toxicity relationships. And that's the other thing I just want to bring up is these can be toxic, and I think it's really important that we learn from this. And we recently have a couple papers on cytokine release syndrome and neurotoxicity. Do you want to just mention anything about that at this point?
Yeah, so I think one of the things with CAR T cell therapy is that these are biological agents, so they're a little less predictable than perhaps a drug that is manufactured as a chemical. So these are drugs that are made from the patient's own T cells. They're made in the laboratory. They're genetically modified,
and they're living therapy.
And they're living therapies, yeah. And the T cells are given back to the patient. Once they get in, they then expand in the patient to huge numbers, really mimicking what a normal T cell would do as part of an immune response.
So it's getting your immune system to reject the cancer, essentially using some artificial means.
Yeah, exactly. And one of the issues with that is that it's to get rid of the cancer, it's a very, very aggressive immune response, and patients can get sick with it. And there are two main problems that we see. One's called cytokine release syndrome, and that's characterized by fevers, blood pressure problems, and other issues. And that can happen really with this massive release of inflammatory proteins and massive targeting of the tumor cells. Another problem that we understand a little less about is neurotoxicity. So these are brain side effects, which in the vast majority of patients are completely reversal, but they can be quite serious. And the most common thing that we would see is in patients who get neurotoxicity is confusion and disorientation, and that can happen in different frequencies in different studies, but around about 20% of patients. So these therapies, although they're extremely effective, and they really are extraordinarily effective for patients who've got refractory and relapsed disease, they do have significant side effects. So treating patients with CAR T cells really needs to be done in a centre that's got a lot of experience in that. It's not the sort of therapy that you'll get from your local medical office and have at home at the moment. It does require a lot of experience, a lot of support to give these therapies.
Yeah, I think that's really key, that we're going to have to do these in specialized centers as we roll out these commercial products. It's important that we learn about how to manage the toxicities, how to preempt the toxicities, hopefully, and maybe we can prevent them in the future. Obviously, these are just the beginning. This is the first commercial approval, and it'll be rolling out for, like I said, pediatric ALL. We need to get these expanded into other cancers. We have clinical trials now in breast cancer and lung cancer. Patients who are interested or doctors who are interested can certainly make referrals through the Seattle Cancer Care Alliance, our intake office. We have ongoing trials in many different diseases. It's been my real pleasure to host this session if you're from the Bezos Family Immunotherapy Clinic and with Cameron Turtle, and thanks for watching.